Do you want a career where you can make good money? Are you interested in medical coding, but you want to learn about the characteristics of a good medical coder so you can see if it's a right match for you? In this video, I'm going to talk about some of the characteristics of medical coders, some of the skills you'll need to learn as a medical coder so that you can make the best informed decision for yourself. If you're new here, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding year based on my more than decade of experience in the industry. If you haven't already, I would highly encourage you to subscribe and hit that notification bell so you can get alerts when I post new episodes. Skilled medical coders are highly in demand and the salary is great. It's one of the few careers that's expected to grow extremely in the next decade. Now, I want to stop right there though and emphasize on a key word that I said, and that's the word skilled medical coders. A lot of organizations will say medical coding jobs are in demand, and that is true, but the bulk of those jobs are for skilled medical coders, coders that have a couple of years of experience. So when you hear colleges or universities or other influencers out there saying, oh, medical coding jobs are highly in demand, understand though that a lot of that is more skilled medical coding. Not saying that you can't find a job just to start out, but it's not going to be the $50,000, $60,000 a year medical coding specialist job to start. And that's because it's not regulated in the way that certain other careers are, like registered nursing. You have to go through a certain degree program, you have to pass certain tests, you have to do a certain amount of clinical hands-on experience. There are people out there who can take a crash course and pass the certification exam just because they might be a really good exam taker. And employers know this, so they're just kind of cautious about who they select for medical coding positions. And one of the easiest ways to kind of filter things out is to say, oh, well, we need a couple of years of experience. So a lot of people will be told, oh, medical coding is so in demand, and then they'll go out there, look for jobs, but they'll see that a lot of the jobs require a year or two of experience. And that's because a lot of those jobs have that title in there, medical coding specialist or clinical coder, but there's lots of jobs where you can use your medical coding skills without actually being titled a medical coder, and you can find out more about those here. So if you're looking to get into a career where you're immediately going to get into a job that is titled exactly like what you went for, like you went for electrical engineering and you're looking for a job as an electrical engineer, you don't always have that direct correlation in medical coding. Not saying at all that it doesn't happen, it's just that one of the more common things you will hear in medical coding is that it takes people a little while to actually get a job as a medical coder. So it has to be something you're really going to enjoy and really aspire to do as a career. I personally know a couple of people that I've met through acquaintances that went through courses that they saw in magazines and learned medical billing and coding, but kind of gave up on it pretty easily. They thought it was something that they could do while they were watching their handful of kids at home, and then were very shocked to find out that there weren't a lot of opportunities like that out there. I personally feel that the risk is worth the reward because healthcare is the largest growing career industry that we have right now. And if you wind up getting that experience that you can do things like freelancing or contract work, your earning potential is practically unlimited. Now let's start out talking about medical coding. People will hear that term coding and they'll think coding like programming, but medical coding is not a programming language. It's not like COBOL or C++. It is really the review of text medical records and then converting all of the different procedures, diagnoses, services, drugs, equipment into various code sets. It's a lot easier from a data perspective to track things via a numeric or alphanumeric code versus a large subjective kind of piece of text. You don't have to memorize the codes. They're all listed in different code books. You can also have computer applications that will help you navigate to the right code, but you do have to oftentimes really read a lot, really analyze and scrutinize tiny little nuances of text like the words and or with. So there is tons and tons of reading and review and understanding the different federal guidelines, coding guidelines, insurance guidelines. So it's detail-oriented work. And you do have to work a lot with different computer programs like navigating through an electronic medical record system and a billing system. And because there's constantly patients being seen and receiving services, it's not something where you're ever going to be done. There's always more work coming in. So you don't get that satisfaction of like, oh, I completed this, it's done. There's going to be a work queue or something similar where you're constantly getting new patient cases in that have to be coded. There's also tons of changes. Just to start out with, each of the different code sets, there are hundreds of changes every year. Codes are deleted, codes are added, codes are revised, guidelines are revised. And just because of the ever-changing scope of healthcare, all of the different coverages of different procedures change. Insurances update their guidelines. There's new federal guidelines. So this is something where you have to be a constant learner. And most organizations only want to hire certified medical coders. They prefer certifications through AAPC or AHIMA. And as part of maintaining your certification, you have to complete continuing education units every year, just like a LPN or a physician would. You have to keep up to date on all of the different trends, so you have to complete a certain amount of continuing education units every year or every other year. The good news is, for example, the AAPC as part of your annual membership cost includes some resources to get a lot of CEUs for free, and there's all kinds of different free resources as well. I have a video that talks about different free and cheap CEU resources here. You can also check out medicalcodinggeek.com. He has a monthly list that's published with different CEU offerings for AAPC and AHIMA. But if you're looking for something specific, maybe you're training for a new specialty and just kind of the nature of the job, having to have all of the updated materials, having to get your CEUs, having to stay abreast of all kinds of different changes, there is a cost associated with being a medical coder. Oftentimes employers will cover a lot of those costs, but sometimes they don't. So just to keep you informed, I did also make this video about the costs of being a medical coder. I'll also link it in the video description in case you want to check it out there when you're done with this video. Now, if cost is important to you and you're just starting out and you're looking for a school where you can save some money, let me tell you about onlinedegree.com. I recommend all of my viewers go to onlinedegree.com because they will pair you up with a school that will prepare you for certification through AAPC or AHIMA. So if you're looking for medical billing and coding education and you want to get paired up with a school that will work with your schedule and save you some money, use my link here, go.onlinedegree.com/contempo, and they will save you 10%. So if you want to save some time and money, definitely check out go.onlinedegree.com/contempo. I will link it in the comments below as well. So you not only need to be adaptable to the changes just in the industry, but also processes and tech. And you have to be adaptable to personal change because you will be regularly audited as a medical coder. So you need to be able to have those discussions about the outcome of your work. And also, is it important to you to have that right away? Is it going to bother you if they're looking at your work from last month or the month prior and analyzing it and reviewing it for areas for improvement? As a medical coder, you might not be getting immediate feedback. It might be happening further down the line after they've recognized that maybe you were not aware of a particular guideline and were maybe ordering certain diagnoses in the wrong way. Now, while there is some freelance and contract work in medical coding, it usually is hard to find it starting out. The bulk of medical coding jobs in private practices, hospitals, billing organizations, they will have some strict deadlines and demands on your time. So there are certain times, particularly near the end of the month, where they're kind of in a crunch and will require you to possibly complete some extra time or make sure that you hit certain deadlines. You might run into situations where you're asked to work overtime, or sometimes you might be pressured into working faster. Some organizations, they're all about getting those codes in so that they can get the bills out the door, because there are some guidelines, particularly with insurances, that you have to have a claim submitted so many days after that service was rendered. So say you're seeing your family practitioner because you have a respiratory infection, you might have an insurance that says that that bill has to get to them within 30 days or they're not going to pay for it. Most insurances, it's longer than that, but some of them, they do have some tighter deadlines. And another big characteristic of medical coding is that you're going to be working with a lot of sensitive information and private information. It's people's medical records. You might see in the emergency department some pretty wild stuff. You might even see people who are victims of sexual abuse. And if you're working somewhere local, you might come across some names that are familiar to you. I have known people in the revenue cycle that have looked up the medical records of their ex-boyfriends or their neighbors and were ultimately let go from their positions because of it. And the organizations that you need to get certified with in order to get a coding job do have a code of ethics. There is an AAPC code of ethics that has to be followed or they can revoke your membership. No membership means no certification. No certification means it's going to be pretty hard to get a medical coding job. So as a medical coder, you have to be very professional and very respectful of that private health information. So if this sounds like it's right for you, you want to make money while doing something meaningful, like making sure that records are assigned correctly, that we have the right data for them, that patients' bills are going to get paid, then medical coding might be great for you. Don't forget about that link in the description to onlinedegree.com. And if you are interested in learning more about the salary of being a medical coder, you can check out this video right here. I will see you guys in the next video. And until then, just keep on coding on.